Ladies, listen closely because what I'm about to tell you could save your life, or at the very least, your dignity and peace of mind. If you ever hear any of these phrases at your clinic visit, stand up, walk out, and never go back. I've worked in this industry long enough to know when a medical professional is no longer acting in your best interest. And yes, this happens far more often than we like to admit. So stay with me all the way to the end, and I'll tell you exactly what to watch out for. Make sure you like this video, subscribe to Savvy Senior, and comment below with, "I trust my instincts." Let's see how many of you know that your gut feeling is often more accurate than a medical chart. 1. It's just your age. If there's one phrase that makes my blood boil as a doctor and a woman, it's this one. It's just your age. Let me ask you this. If a car makes a strange sound, do you tell the owner, "Well, it's old, so don't worry about it"? No. You pop the hood, check the engine, and figure out what's going wrong. The same logic should apply to the human body, especially a woman's body after 60 or 70. Aging may bring natural changes. Yes, but not everything that happens to you is a normal part of getting older. Here's what I see far too often. A woman walks into the clinic with knee pain. The doctor barely looks up from their notes and says, "It's just arthritis, common at your age." Or someone comes in with chronic fatigue and brain fog, and the doctor says, "Well, that's expected. You're in your 70s now." No lab work, no further investigation, no curiosity, just dismissal. But what if that fatigue is due to a B12 deficiency or undiagnosed hypothyroidism? What if that knee pain is actually the early signs of rheumatoid arthritis, which requires very different treatment than standard osteoarthritis? What if the dizziness is related to an irregular heartbeat, or worse, an early stroke warning? Do you see the danger? That phrase, "It's just your age," is a subtle but serious form of age discrimination. It's a lazy excuse that pushes aside real, valid concerns just because the person expressing them happens to have a few more candles on their birthday cake. And here's the truth. Doctors get away with it because many older women don't push back. They've been conditioned to not make a fuss or to trust the expert. But sometimes the expert is wrong, or tired, or rushing, or simply doesn't care. So, if you ever hear this phrase at your appointment, pause, take a breath, and say, "I understand aging comes with changes, but I'd still like to explore what's causing this specifically." If they push back, leave. You deserve a doctor who treats you as an individual, not a stereotype. 2. Let's wait and see. With no clear plan. Now, don't get me wrong. There are situations where wait and see is a medically responsible option. For example, if you've had a mild cold for a day or two, or a small rash that doesn't seem to be spreading, sure, waiting a few days makes sense. But when a doctor says, "Let's wait and see," without explaining the reason, timeline, or follow-up plan, you should be concerned. Let me give you a real example. A woman I knew came in with breast tenderness and swelling on one side. No trauma, no infection. She was told, "Let's wait and see if it goes away." No ultrasound, no blood work, no mammogram. She waited. 3 months later, it was inflammatory breast cancer. By then, it had spread. That's the hidden danger in vague phrases like wait and see. When used properly, they should always be paired with specifics. What are we waiting to see? How long should we wait? What should I look out for in the meantime? When do we reassess? And how? If you don't get answers to these questions, your health is in limbo, especially for senior women whose bodies are already going through complex changes. Time can be critical. Things don't always resolve themselves. And when they don't, delayed care can lead to irreversible damage. Wait and see can become a trap, a delay tactic, a way to move on to the next patient quicker. So don't let it slide. If you hear it, follow up with, "Okay, And what specifically should I watch for? When should I come back? Will we be doing any tests at that time? If the answers are vague, trust your gut. Go elsewhere. 3. You don't need that test at your age. Let's talk about this dangerous and dismissive little phrase. You don't need that test at your age. Excuse me? So many women are denied life-saving screenings, diagnostic imaging, or blood tests simply because they hit a certain number. It's infuriating, and it's unethical. Now, yes, sometimes tests have risks, and sometimes if a woman is very frail or has a terminal illness, it might be wise to avoid certain invasive procedures. But here's what's actually happening in too many clinics. Older women are being denied basic preventive care like colonoscopies, mammograms, or heart screening tests, not because of any medical reason, but because someone behind a desk decided that their quality of life doesn't justify it anymore. Let me tell you about and was 74, active, sharp, and full of energy. She asked for a routine colonoscopy because she hadn't had one in 10 years. The doctor said, "You don't need one. It's not recommended after 70. She insisted. They found early-stage colon cancer. She had it removed, recovered beautifully, and is still hiking today. That test probably added a decade to her life. It's about context, not age. You have to ask, what is my current health status? How will this test benefit me now and in the next few years? Are there safer alternatives? If your doctor refuses a test and can't give you a clear, evidence-based explanation, don't just accept it. Ask for the rationale. And remember, you're the one living in your body, not them. 4. Are you sure it's that bad? This one is subtle, but it's one of the most invalidating things a doctor can say, especially to a senior woman. Let's set the scene. You go into your appointment and say, "Doctor, I'm really struggling. I've had this stabbing pain in my side for 2 weeks. It's exhausting." And the doctor tilts their head, raises an eyebrow, and says, "Are you sure it's that bad?" Instantly, you feel a mix of doubt, shame, and confusion. You start wondering, am I being dramatic? Maybe I'm overreacting. And just like that, you're silenced. That's called medical gaslighting. Older women are especially vulnerable to this because society often paints them as emotional, fragile, or forgetful. So when a senior woman says, "I'm in pain," many doctors, consciously or unconsciously, minimize it. But here's the truth. Pain is personal. There is no scan or blood test that can prove how much something hurts. You know what you're feeling. And if something feels unbearable, that is your truth. And it should be respected. This kind of doubt from a doctor often leads to undertreatment. You're sent home with Panadol when you need real intervention. You're told to monitor it when you actually need imaging. And worst of all, you start to doubt yourself. That's the worst kind of harm a doctor can do. So if someone questions your description of your own suffering, don't just shrink back. Say, "Yes, I am sure, and I'd like it taken seriously." And if they still don't listen, walk out. Find someone who does. You've earned the right to be believed, not brushed off. 5. Let's talk about losing weight first. When it has nothing to do with your problem. This one right here, it's one of the most insidious and frustrating things older women experience in the doctor's office. Let's say you go in because your back hurts, or maybe you're having frequent migraines or numbness in your hands. And before the doctor even asks about your daily activities, medications, or medical history, they're already talking about weight. Well, maybe we should start by talking about losing some weight. Hold on. What? You came in for one issue and suddenly your entire health status is being reduced to a number on a scale. Now let me be clear. Yes, weight can affect health. But here's the difference. Weight should never be the first thing addressed if it's not relevant to the symptom you're reporting. And it should never be used as a deflection from doing real diagnostics. Let me tell you a story. A woman named Eleanor, 69 years old, went to her doctor because she had been experiencing shortness of breath and heart palpitations. The doctor took one look at her chart, saw she was technically in the obese category, and said, "This is why we need to focus on losing weight. Once you slim down, these symptoms will improve." That's it. No tests, no ECG, no referrals. 3 months later, she was rushed to the ER with a massive heart blockage. She didn't need a diet. She needed a stent. And she needed someone to listen. The issue isn't that weight gets mentioned. It's when and how it's used. Too often, it becomes the only topic, and the real medical concern gets ignored. So if your doctor jumps to weight when it doesn't relate to your symptoms, here's what you say: "I understand weight is one piece of the puzzle, but I came in to discuss X, and I'd like us to focus on that today." If they resist, that tells you everything you need to know. You are not a number. You are not a body mass index. You're a full human being, and your pain deserves attention. 6, let's just put you on an antidepressant. Without digging deeper, this one breaks my heart, and it's far more common than most people realize. There's a disturbing trend in modern medicine, especially when it comes to older women. You walk in feeling off, maybe low on energy, not sleeping well, irritable, or tearful. You try to explain that something just doesn't feel right in your body. And before any blood work is ordered, before anyone checks your thyroid or nutrient levels, before they even ask about recent life changes, the doctor says, "Let's try an antidepressant." Now, listen carefully. I am not against antidepressants. They've saved lives, improved mental health, and helped millions of people, including many seniors. But what I am against is this: using antidepressants as a shortcut for real medical investigation. Here's the issue: symptoms like fatigue, brain fog, sadness, or anxiety can have dozens of causes. Hormonal changes, vitamin deficiencies, especially B12D, iron, chronic infections, sleep apnea, grief and loss, medication side effects, thyroid problems, and yes, depression itself. But if your doctor doesn't bother to rule out the rest and jumps straight to a pill, you're being dismissed, not treated. I once saw a patient who had been on antidepressants for 6 months. She said they didn't help much. Guess what? Her thyroid was barely functioning. Once that was treated, her mood lifted, her energy returned, and she didn't need the antidepressants at all. This is what happens when doctors label you instead of listening to you. If you ever feel like you're being handed a prescription just to get you out the door, push back. Ask, "What else could this be? Can we do some tests first?" Your emotions are not a nuisance. They're signals. You deserve to know where they're coming from. 7, you're probably just lonely or bored. This one is deeply insulting, and it happens far more than most people would believe. When a senior woman goes to the doctor with complaints like fatigue, stomach issues, body aches, or trouble sleeping, and the doctor says something like, "You're probably just lonely or bored," it's not just dismissive, it's dehumanizing. Think about it. Would they say that to a middle-aged businessman who came in with the same symptoms? Would they suggest he was just bored? Let's talk about the deeper issue here. This phrase is rooted in a stereotype that older women are fragile, emotional, and spending their days waiting by the phone for their grandkids to call. It assumes that your health complaints are nothing more than side effects of loneliness or a dull routine. Now, I understand loneliness is a health concern. It can affect your heart, your brain, even your immune system. But loneliness is never a valid excuse to ignore physical symptoms. Too often, doctors use this label when they don't want to deal with complex cases. Instead of saying, "I don't know what's causing this," they say, "Maybe you just need a hobby." It sounds harmless, but it's not, because it makes you question yourself. It makes you think, maybe I am imagining this. Maybe it's all in my head. No, it's not. If something feels wrong, Trust that feeling. You didn't survive 70+ years just to be told you're bored. Demand more. You are not a cliché, you are a patient. And you deserve more than a shrug and a stereotype. 8. That's normal for someone your age. When it's clearly not. Let's end this section with one of the most overused phrases in modern healthcare. That's normal for someone your age. Now, I want to make something very clear. There are things that become more common as we age. It's normal for bone density to decrease. It's normal for skin to become thinner. It's normal to have some memory lapses here and there. But you know what's not normal? Bleeding after menopause, chest pain or pressure, difficulty swallowing, sudden weakness in your limbs, extreme weight loss, confusion or disorientation, chronic, unrelenting fatigue. These things are not just getting older. They're red flags. And here's the danger. When doctors label these serious symptoms as normal, they shut the door on further testing. You don't get the scans. You don't get the blood work. You don't get the answers. And that's how things get missed. Until it's too late. I'll never forget a patient who came to me after being told for over a year that her stomach pain and bloating were normal for her age. By the time she saw me, she had advanced ovarian cancer. If someone had taken her seriously a year earlier, her outcome might have been very different. So let me say it loud and clear. Normal aging should never hurt. If something feels wrong, speak up. And if your doctor tells you it's just aging, but you know in your gut that it's not, get a second opinion. Or a third. You know your body. You live in it every day. Don't let anyone tell you what's normal when your instincts are screaming otherwise.